Good evening and thanks for joining us here on News Center Maine at 5:30. I'm Chris Costa.
And I'm Zach Blanchard. Since October 25th, lawmakers in Augusta have been debating the best way to respond to the mass shooting that killed 18 people. Is it best to reform firearm access in the state, or should the state implement laws surrounding mental health?
Today's conversation in Augusta was about doing both. News Center Maine's Jack Mulman brings us the details from the studio. Jack?
Chris and Zach, the focus today was on two different bills. One would require a 72-hour waiting period from when someone purchases a gun to when they can actually use it. Now, the other bill, sponsored by Governor Janet Mills, creates an injury and violence prevention program in the Center for Disease Control and Prevention. Now, neither of these bills are as drastic as other gun reform legislation we've seen. Still, there are well over 100 people looking to make their voices heard today.
The chair may limit testimony at public hearings as necessary.
Not one, but two overflow rooms. Those against gun reform bills in orange, and those for the bills wearing buttons and holding signs.
I come from a community with broken hearts and shattered lives.
No matter which way you spin it, the tragedy from October 25th, where 18 people were killed, warrants action for all of these people.
And we need some basic common sense gun safety measures to keep us all safe.
Camilla Shannon is the board president for the Maine Gun Safety Coalition. She's for both bills and says the 72-hour waiting period can not only prevent a homicide, but suicides as well.
Allows people to get help, to move through difficult emotions, and it's been shown to reduce rates of suicide, but also homicide.
And for Republican lawmakers, the 72-hour waiting period is a tough sell, especially for Representative Donald Artell of Monticello.
People who do know they won't pass a background check don't subject themselves to them. If they want a gun, they go and get it another way, through on the street or stolen.
He says if someone with bad intentions wants a gun, they'll get one, no matter the laws.
It's an ineffective policy and it's not good governance. I think there are people who are actively hostile to our Second Amendment rights and will attempt to erode them any way they possibly can.
According to a study published by the National Institute of Health, 9 other states have implemented some sort of waiting period surrounding gun purchases. The study found homicide rates by firearms went down by 17%.
The primary focus is on prevention, strengthening Maine's mental health system, and dangerous people from keeping them from possessing firearms.
Regarding the second bill, with a mental health focus, Department of Public Safety Commissioner Mike Soschuk is in support of it. It would establish an injury and violence prevention program at the CDC and also fund more mental health crisis centers.
But these are proposals that are not extreme or unusual.
And throughout the day, testimony went back to the Lewiston shooter's mental health decline. According to investigators, family, friends, and coworkers tried to report him to authorities, but nothing stopped him. And for Republican lawmakers, existing laws could have stopped the shooting, but they just weren't used.
This is not a failure of legislation. This is a failure of execution.
Now, these two bills are pretty much down party lines, Democrats for and Republicans against. But Republicans did tell me that they liked some of the mental health components of the governor's bill, LD 2224. Now, we asked Governor Janet Mills' office if she would support the bill requiring the 72-hour waiting period. They did not give us a concrete answer, but said the governor wants to take some sort of action this legislature. Chris?
Jack Mulman in the studio tonight. Thanks so much.